The links between tobacco and cancer are now so well established, as Professor Suram has said, that really we don't need to do very much new research on this. There are some areas where the links between tobacco and cancer are still need to be, the causal association needs to be established, so there might be some areas. The real challenge we face is how to make a difference, how to apply the science we know to policy and to changing behavior. And really one of the issues I want to focus on is one of the major challenges we face in South Africa, and on which we have done relatively little, and that's smoking in the home. Now many of you will remember the bad old days, not the good old days, the bad old days, when people used to smoke anywhere and everywhere, and non-smokers used to have to fight for their right to clean air. As this slide shows, it comes from back in the 1980s, I think, or early 90s. I'm going to smoke, Mac, sitting in a restaurant, and the person next to him says, but if you smoke, I'll choke. And typical of the smoker in those days, they're not so bad these days anymore, the response was, so choke then, what do I care? And the next response is, say when. Okay? Those were the bad old days, when we used to fight about it. Happily, things have changed. And now smokers have to go, smokers have to go outside. And as this slide says, you know, this is as bad as when I started the damned habit 40 years ago, out behind the garage. Okay, things have changed, and changed for the better. What's the current situation in South Africa on smoking in public places? Well, back in 2001, or rather in 1999, the Minister of Health amended the Tobacco Products Control Act, and the law was changed so that we ban smoking in public places, in all enclosed public places, in workplaces, and on public transport. The 1999 Act was further amended in 2007, so that in last August, the new law came into effect, and we now ban smoking in cars where children under 12 are present, in all commercial childcare facilities, and the reasons for the changes in the Act I'll explain a little later. In selected outdoor areas, sports stadiums, railway platforms, regulations specifying the areas are still being prepared by the Department of Health. We expect that these will be gazetted within the next 2 months or so, and they'll come into effect hopefully by the end of the year or early next year. In partially enclosed areas, so that if you've got a partial roof covering an area, that smoking is now prohibited there as well, and within prescribed distances of entrances into buildings and ventilation inlets. So we're going to move people away. You know, at the moment, if you want to come into a building, you have to walk through a whole host of smokers standing outside. We're going to move them away from the entrances. Again, the exact distance is still to be decided, but that's something that's going to come pretty soon. It'll probably be about 5 meters away from entrances or air inlets into buildings. Nobody under 18 years may enter a designated smoking area, and fines for smoking in non-smoking areas increased from 200 rands to 500 rands for an individual and 50,000 rands for a business. So those restaurants, etc., that used to allow smoking because the fine was 200 rands, they didn't even think twice about it, now face substantial fines. And one of the successes of our campaign is, of course, the World Cup. It's now come and gone, but this was a sign that was shown at the World Cup during the interval and before the game. All spectator viewing areas during the World Cup were smoke-free. And that's the National Council Against Smoking's logo there. Unfortunately, the success was in the spectator viewing areas, but the minute you walked out of the spectator viewing areas, smoking was terrible. But at least it was a partial victory. So the happy fact is that the law has been successful. And the real reason the law has been successful is that ordinary citizens demanded their right to clean air. I keep repeatedly saying, it was not a policeman sitting in every aeroplane, every cinema, every theater, every shopping mall waiting to arrest smokers that made the law a success. It was ordinary citizens. And even today, 8 years after the law has been passed, I still get telephone calls from people saying, the law is not working here or the law is not working there. What can I do about it? Not me as the National Council Against Smoking, but me as Joe Citizen. How can I change my environment for the better? I think the tobacco control laws are one of the best examples of primary health care at its best. The law creates an enabling environment in which citizens can exercise their rights to get better health. And I really think this is one of the good places we have. That's the happy fact. The unhappy fact is that major challenges lie ahead. And I chose this slide deliberately because the tobacco industry wants to portray the modern woman, and I'll speak more about this as well, as somebody who smokes cigars. Success is associated with cigars, and the successful black woman smokes cigars. Okay, the major challenges we face are that smoking is still allowed in some restaurants and hotels. And we also have the problem that we have designated smoking areas. And having designated smoking areas unfortunately reduces but does not remove the pollution of the non-smoking areas. As somebody once said, having smoking and non-smoking areas is like having peeing and non-peeing areas in a swimming pool. The particles move everywhere. Okay. Then in 2004, a new global phenomenon emerged. And that was Ireland became the first country in the world to ban smoking completely indoors. And as this slide shows, the wife says to the husband, I can tell you've been to the pub. There's no smell of smoke on your clothes. And I was in Ireland, and for purely research reasons, I went into a pub. And I watched these people. They'd sit there with their pint there, and then when they felt like a smoke, they'd go outside, smoke their cigarette, come back after 5 or 6 minutes, and resume their drinking. And the law worked beautifully. So what is the greatest challenge we face now in terms of smoking in public places and secondhand smoking? And in my view, the greatest challenge we face is, well, before I say what it is, let's just look at where are people exposed to tobacco smoke. There's three principal places where we're exposed to tobacco smoke. In the home, where the smoking parent exposes the non-smoking child to tobacco smoke, or where the spouse exposes the non-smoking spouse to tobacco smoke. In public places, when we go to work, offices, shopping malls, bars, restaurants, and in vehicles, cars, public transportation, trains, etc. Now, in South Africa, our law has dealt with two of those, public places and vehicles. But the law deliberately decided to exclude homes from the legislation. That was a deliberate decision by Parliament with, in my view, very, very adverse consequences for the health of people. And I'll say a little bit more about this in a second. Who are the victims of smoking in the home? The victims of homes polluted with cigarette smoke are essentially children, women, and domestic workers. And I put in brackets men. The reason I put in brackets and in small letters men is that the majority of people who smoke in South Africa are men. And about 40%, 35% of men in South Africa smoke compared to about 10% of women. So there's a big difference in prevalence of smoking. And in particular, it's the children and the women and domestic workers. I went to Parliament and I asked Parliament to say to them, you have banned smoking in workplaces. The workplace is a home for, the home is a workplace for women, for domestic workers. If you are going to be fair and equitable, you need to restrict smoking in the homes if they employ a domestic worker. To my horror, an ANC MP said to me, if domestic workers don't want to work in smoke-exposed homes, they can find another job. This was not the opposition or a right wing. This was an ANC MP. And I could not believe what I heard. But the bottom line is that all our labor laws, which apply equally across the board, do not apply to the least powerful group of people in our country. And that is wrong. That is something we need to remedy. This hasn't happened once. It happened in 1998 when we banned smoking in the workplace. We asked Parliament to include domestic workers. They excluded them. And in 2007, they repeated the same mistake. Really, it is wrong. And that's why I say it is one of the greatest challenges we face in terms of secondhand smoking.